So question from Dr. Bishal Gupta. Um, Excellent case. Can pre-transplant HHV serology predict for HHV transmission, I suppose?
Yeah, so there's quite good data that was published by that Mediterranean group that, like I mentioned, has been screening since 2011. So they presented the data not just on HHV8 positive um, donors, but all donors that were screened. So it is endemic in that area in the Mediterraneans. Their numbers are quite a bit higher than we would expect here. Seroconversion was really, really high in their recipients. So if you had a positive serology in the donor, it was almost 100%. I can't remember the exact numbers, but very high seroconversion in the recipients, but not all of them actually developed clinical disease. The numbers of disease were less than that, around 50%, 40 to 50% developed some kind of syndrome that could be compatible with human herpes virus 8 infection. And then a subset of them obviously were life-threatening. So, yeah. Yeah, so the question for those online was how do we know what we expect our prevalence to be in Australia? So the best data we have was from looking at serology in blood donations. That was done a while ago now. And obviously that's a select population as well, obviously, right, of people who are making blood donations. And then that was about 5.7%. And the numbers of that were a few hundred. So that's the best data we have. And without having local serology available, it's really hard to do any further evaluations of that. Interestingly, in other countries that have done seroprevalence studies, have found a correlation in higher rates of men who have sex with men, that population. And that was not found, interestingly, in the Australian data. There didn't appear to be any correlation there. So yeah, it's without knowing better numbers, it's very, very difficult, obviously. Well, we're going to need more numbers. We're going to need an assay.
Can you tell I have an agenda?
Yeah, yeah. Without having local testing and without doing some local, without knowing what our actual seroprevalence is, it's very hard to make a risk benefit about whether what should be rolled out and when, because we have no idea about what our prevalence in our donor pool is.
Sam, with your agenda, just to speak to that. Sorry, it's Lana Sundak here for those online. So the TSNZ Transplant ID Special Interest Group has taken this on as a potential project, and unfortunately, it's parked because of the lack of availability of serologic testing. One of the challenges is that serology is fraught. So basic ELISA tests are of poor sensitivity. Specificity is also an issue. The confirmatory testing is usually with immunofluorescence testing, which is labor intensive, expensive, needs expertise for interpretation. So the Italian centre, as well as the proposal for the UK, is to do testing initially with an ELISA up front and then confirm with a second assay, which is usually the immunofluorescence assay, which is not readily available. So we can't even describe the epidemiology in Australia yet, let alone then delve into the benefits of potentially modifying immunosuppression in recipients who are seronegative from a positive donor. So that's the main hurdle. Yeah. Absolutely. So, some of the further information about that donor was that, he was covertly MSM as a risk factor. He, on the face of it, hadn't actually had any other risk factors. He wasn't from an endemic area. And our patient, testing was done on both samples just with PCR. But the PCR is not a good screening tool for donors who are generally asymptomatic. It's only really helpful in cases of the disease like Hicks.
Yeah, and the study over the Mediterranean, obviously, presumably higher numbers than we have. They obviously have found a lot of value in it and intend to continue doing it, and they're instituting changes away from tacrolimus to sirolimus in those patients, and making some changes to immunosuppression, early institution of rituximab in anyone that's showing any signs of multicentric Castleman's disease or KICS, and they seem to be getting good results from that. So there's certainly potential for benefit.
Okay. I guess that's all the time we have for questions today. Okay. So thank you to all our presenters for presenting. It's been a very informative and interesting morning session.